Every year, millions of older Americans walk into clinics believing that more tests mean better health. It feels responsible. It feels proactive. After all, catching something early should be a good thing, right? But what if I told you that some of the most common checkups, those routine tests that feel almost automatic after age 70, might actually do more harm than good? Not because the tests themselves are flawed, but because the way we use them, especially in older adults, can lead to a cascade of unnecessary treatments, emotional stress, and physical harm. You see, the human body changes with age. So does the way disease shows up, and most importantly, so does the risk-benefit balance of medical testing. What helps a 50-year-old might not help a 75-year-old the same way. In fact, several major health organizations in the United States, including the U.S. Preventive Services Task Force and the American College of Radiology, now advise against certain routine screenings in older adults, unless there are clear symptoms or risk factors. But despite that, many older Americans are never told they have a choice. They're handed a referral, booked for a scan, or scheduled for a procedure, often without a real conversation about what it could mean or what might come next. That's why today, we're having that conversation. In this video, we'll walk through 5 common medical checkups that might seem helpful, but for people over 70, could potentially do more harm than good. Each one will be backed by real scientific research and include practical alternatives that focus on quality of life, not just test results. So if you or someone you love is navigating medical decisions in your 70 seconds or beyond, this is for you. By the end of this video, you'll be better equipped to ask smarter questions, avoid unnecessary procedures, and take back control of your health journey. Let's start with the first checkup on our list, one that sounds perfectly harmless, but could quietly cause more problems than it solves. Let's begin with a test that sounds completely harmless, a bone density scan, also known as a DEXA scan. It's quick, painless, and doesn't involve any needles or fasting. You simply lie on a table, the machine scans your hips and spine, and your doctor tells you whether your bones are strong or at risk for fractures. For many people, this test becomes a routine part of annual health checkups after turning 65, especially for women. But here's the surprising truth. For people over 70 who haven't had recent fractures or falls, this scan may offer little benefit and can sometimes open the door to treatments that carry more risk than reward. Bone density naturally declines with age. That's not a disease. It's part of aging, just like graying hair or wrinkles. But DEXA scans often flag even mild, age-appropriate changes as osteopenia or early-stage bone loss. And that's where the trouble begins. Many older adults are then prescribed medications called bisphosphonates, drugs like alendronate or risedronate, which are meant to strengthen bones. However, these medications can cause serious side effects, such as inflammation in the esophagus, severe heartburn, and in rare cases, a painful condition called jaw osteonecrosis, where parts of the jawbone begin to die. More importantly, the actual benefit in people over 70 is questionable. A major study published in the Journal of the American Geriatric Society followed over 1,200 women aged 70 and older. After 5 years of taking bisphosphonates, the risk of hip fractures dropped by just 0.3%. That's a tiny improvement, and for many, the side effects were worse than the problem being treated. Let me share Rose's story. She's 76 years old, a retired piano teacher who lives an active life. At her annual checkup, she was sent for a DEXA scan, even though she had never fallen and had no bone pain. The results showed mild osteopenia. Her doctor immediately prescribed alendronate. Within a few months, Rose developed severe acid reflux and jaw discomfort. Playing piano became painful. She lost confidence and began to avoid social events. When we reassessed her situation, we stopped the medication and instead focused on weight-bearing exercises like resistance bands, improving her calcium intake with leafy greens and sardines, and correcting her vitamin D deficiency. A year later, she had regained her strength and was back to performing music again. The bottom line? For adults over 70 who haven't had fractures or symptoms, lifestyle changes are often more effective and far safer than medication. In fact, a 2022 study published in Osteoporosis International found that regular strength training, balance exercises, and maintaining healthy vitamin D levels can reduce fracture risk by over 20%. So, before you agree to treatment based on a number from a scan, ask whether the test truly reflects a danger or just the natural process of aging. And now, let's move on to the next checkup, one that sounds high-tech and reassuring, but can lead to far more worry than clarity: the brain MRI. Now, let's talk about something that causes quiet fear in so many older adults: memory loss. Forgetting names, misplacing keys, walking into a room and wondering why. These small lapses are incredibly common after age 70, but they often trigger deep worry about dementia or Alzheimer's. And in many cases, that worry leads to one very expensive, very dramatic test: the brain MRI. A brain MRI sounds like a smart step. It's a high-tech scan that shows detailed images of the brain's structure. Doctors often recommend it when a patient mentions memory issues, hoping to find a clear explanation. But here's what most people aren't told. In the majority of older adults, especially those with mild forgetfulness and no other symptoms, brain MRIs rarely provide helpful answers. Instead, they often reveal something called age-related changes, things like slight shrinkage or white matter spots that are completely normal for someone in their 70s or 80s. But once those spots show up in a report, it can set off a chain reaction. Suddenly, a harmless scan becomes a source of fear. Patients may be sent for more scans, spinal taps, or even exploratory procedures. And worse, they might begin to view themselves as sick even when they're not. That fear alone can lower quality of life. There's data to back this up. A 2021 review published in Neurology Today analyzed over 3,000 brain MRIs in adults aged 70 to 85 who had mild memory concerns. 86% showed some kind of abnormality, but only 3% of those findings were linked to an actual treatable condition. That means 97% of people went through emotional distress, further testing, and sometimes even unnecessary procedures, all without any meaningful benefit. Let me tell you about George, a 74-year-old retired engineer. He came in worried that he was losing his sharpness. He'd forget appointments occasionally, and sometimes struggled to recall names at church. His doctor ordered an MRI, which showed small white matter changes. George panicked. He stopped driving, withdrew from his community, and began preparing for life with dementia. But when we gave him a simple, evidence-based cognitive screening test, his results were well within the normal range. He wasn't declining, he was aging normally. We worked with him to improve his sleep, reduce anxiety, stay hydrated, and engage his brain through puzzles and social interaction. 3 months later, his memory was back on track, and so was his confidence. The truth is, unless someone is showing clear signs of neurological trouble like seizures, dramatic personality changes, or rapid functional decline, a brain MRI is rarely the right first step for memory issues. Instead, most experts recommend starting with a basic cognitive screening test. It's low-cost, non-invasive, and often gives a clearer picture of what's really going on. So before you agree to a brain scan for forgetfulness, ask whether your symptoms truly require imaging or if a simpler, gentler approach might bring more peace of mind. Next, let's move to a checkup that's especially common in older adults who feel a little more tired than usual: the cardiac stress test. Now let's talk about fatigue. Not exhaustion, Not crushing chest pain, just that subtle tiredness that creeps in as you age. Maybe you used to climb stairs without a second thought, and now you pause halfway. Or maybe your walks are just a little slower than they used to be. These small changes often lead older adults to visit their doctor, and in many cases, that visit ends with a referral for a cardiac stress test. On the surface, it makes sense. The stress test is designed to check how your heart performs under pressure. You either walk on a treadmill or receive medication to simulate exercise, while your heart rhythm is monitored through EKG and imaging. The idea is to detect blocked arteries or other signs of heart disease. But here's the issue: when used on people over 70 who don't have clear symptoms of heart trouble, the test often creates more confusion than clarity. Studies show that in older adults without obvious cardiac symptoms, the rate of false positives, meaning the test says there's a problem when there isn't, can be as high as 40%. That's a big number. And a false positive doesn't just end with a shrug. It usually leads to more testing, angiograms, catheterizations, and sometimes unnecessary stent placements, or even bypass surgery. Each of these procedures comes with risks: bleeding, infection, kidney damage from contrast dyes, and longer hospital stays. A landmark 2017 study published in JAMA Cardiology found that more than half of all stents placed after stress tests were done in patients who had no meaningful symptoms and gained no survival or quality of life benefit from the procedure. In short, they went through invasive, high-risk interventions without feeling any better afterward. Raymond is a perfect example. He's a 75-year-old retired postal worker who stays active by walking every day. During a routine visit, he mentioned feeling more tired than usual when walking uphill. His doctor, out of caution, ordered a stress test. The results were inconclusive. So he was sent for a catheterization, a procedure that involves threading a tube through the arteries to look for blockages. A mild narrowing was found, and a stent was placed. That night, Raymond had a severe reaction to the contrast dye used during the procedure. He developed kidney problems, spent 6 days in the hospital, and needed weeks of follow-up care. The worst part? His fatigue didn't improve because it wasn't caused by his heart. It turned out he was slightly dehydrated and not eating enough protein during the day. Simple lifestyle adjustments would have helped more than the procedure ever could. That's why many cardiologists now recommend a different approach. If you're not experiencing chest pain during activity, shortness of breath with light exertion, or a significant drop in your usual energy level, a stress test may not be the right choice. Safer alternatives include a resting EKG, which checks the heart's rhythm while you're still, or a coronary calcium scan, a non-invasive, low-radiation test that assesses plaque buildup in the arteries. In medicine, more isn't always better. Especially as we age, thoughtful testing can mean the difference between peace of mind and a long road of unnecessary intervention. Coming up next, we'll look at a test many people assume they need every decade, but after 75, the risks might far outweigh the benefits. Let's talk about colonoscopy. Let's turn now to a screening test that many people view as a gold standard for cancer prevention: the colonoscopy. For years, adults have been told to get this test every 10 years after age 50, and for many, it's become a familiar part of routine care. But what happens when we carry that same routine into our 70s and beyond? The truth is, colonoscopy is a powerful tool, but it's not one size fits all. As we get older, the balance between its benefits and its risks begins to shift. The U.S. Preventive Services Task Force recommends routine colorectal cancer screening only until age 75. After that, it's no longer a blanket recommendation. Instead, it becomes a personal decision, one that should be based on your overall health, life expectancy, and whether you've had clear results in the past. Why the caution? Because the procedure isn't as harmless as it may seem. First, there's the preparation. Colonoscopy prep usually involves strong laxatives to clear out the intestines. For older adults, this can lead to dehydration, electrolyte imbalances, dizziness, and even kidney strain. Then comes sedation. The medications used to put you to sleep can carry real risks in people over 70, especially affecting memory and cognitive function in the days or weeks afterward. And during the procedure itself, complications can occur, things like bleeding, small tears in the colon wall, or irregular heart rhythms caused by sedation. A 2019 study published in JAMA Internal Medicine looked at over 1.3 million Medicare patients aged 70 and older. The findings were eye-opening. For every 1,000 colonoscopies performed on people over 75, only 2 lives were saved. But more than 20 people experienced serious complications. That's a risk-to-benefit ratio of 10 to 1. Let me tell you about Dana. She was 73, a proud grandmother who ran a small bakery with her daughter. She was active, had no symptoms, and no family history of colon cancer. Still, during a new patient visit, her doctor urged her to get a colonoscopy just to be safe. She agreed. During the procedure, a small polyp was removed, which seemed routine. But later that evening, Dana began to feel sharp abdominal pain and fainted. She was rushed to the hospital, where they discovered a perforation in her bowel. She spent 9 days recovering, lost weight, and said she never quite felt the same again. When her case was reviewed, it turned out she had already undergone 2 clean colonoscopies in the past. There was no pressing reason to repeat the test. If you're over 75 and generally healthy, there are safer alternatives. One of the most effective is the FIT test, which stands for Fecal Immunochemical Test. It's a simple stool test that you can do at home, no prep, no sedation, no procedure. And studies show it can still detect many concerning cases early enough for effective treatment. Before scheduling another colonoscopy, talk with your doctor. Ask if the test is truly necessary at your age, or if it's simply part of a routine that no longer fits your body's needs. Coming up next, we'll explore the most controversial test on our list, the full-body CT scan, and why this high-tech promise of early detection may carry unexpected dangers. Now let's talk about a test that sounds futuristic and incredibly thorough, the full-body CT scan. It's often marketed as part of premium health packages, or advertised as the ultimate way to catch cancer early, before symptoms even begin. For many older adults, it feels like the smart, proactive thing to do. After all, who wouldn't want to see inside their entire body to make sure everything is okay? But here's the truth. For people over 70, full-body CT scans can create more problems than they solve. A full-body CT scan exposes your entire body to ionizing radiation, typically between 10 and 20 millisieverts per scan. To put that into perspective, that's the same amount of radiation as about 500 chest X-rays. While that might sound like just a number, radiation exposure is cumulative, and the older we get, the more vulnerable our tissues can become to its long-term effects. According to a 2023 modeling study published in JAMA Internal Medicine, the growing use of CT scans in the United States may now account for up to 5% of all cancers. That's the same percentage attributed to drinking alcohol regularly. In other words, a scan meant to detect cancer may actually increase your risk of developing it. And that's just the beginning. These scans often find things, tiny nodules, cysts, or calcifications that are completely harmless. But once those findings appear on a report, it sets off a chain reaction. Patients are sent for more imaging, then referred to specialists, and in many cases, subjected to invasive biopsies or even surgery, all for something that might never have caused a single problem. Let me tell you about Marcus, an 80-year-old martial arts instructor who felt great. He stayed active, ate well, and had no complaints. He signed up for an executive health screening that included a full-body CT scan, just for peace of mind. The scan showed a tiny nodule in his lung, only 3 millimeters wide. It was likely benign, but to be sure, he was referred to oncology, sent for a PET scan, and later underwent a needle biopsy. During the biopsy, his lung partially collapsed. He was hospitalized and needed 2 months to recover. The final result? The nodule was harmless. The entire ordeal could have been avoided. Experts across the board, from the American College of Radiology to the FDA, now warn against using full-body CT scans in healthy adults without symptoms. The potential for harm is simply too high, and there's no evidence that these scans actually extend life or improve outcomes. So, what's the better alternative? Simple. Listen to your body. If you're feeling well, keep up with regular visits to your primary care physician. Focus on managing chronic conditions, staying active, eating well, and watching for new or unexplained symptoms. If something does come up, targeted imaging can be ordered based on specific concerns rather than casting a wide net and hoping for reassurance. When it comes to aging wisely, more tests don't always mean better health. Coming up next, we'll bring everything together and share what real prevention can look like after 70. So now we've walked through 5 common medical checkups that, while often well-intentioned, may not always serve people over 70 inches the way we hope. Bone density scans, brain MRIs for mild memory loss, cardiac stress tests without clear symptoms, routine colonoscopies after age 75, and full-body CT scans. Each of these has its place in modern medicine, and for certain individuals in specific situations, they can be life-saving. But as we age, the rules begin to change, not because we care less about our health, but because how we define health evolves. After 70, real prevention isn't always about chasing every potential diagnosis. It's about protecting your energy, your independence, and your peace of mind. That means asking new kinds of questions before saying yes to a test. Questions like, what happens if this test finds something? What's the next step? Will it improve how I feel or how long I live? And perhaps most importantly, is this test being done for me or simply out of routine? Modern medicine is powerful, but it's also complex, and sometimes doing more means risking more. That's why many medical societies now urge doctors and patients to have deeper conversations about risk, benefit, and what truly matters to each individual. What matters to one person might be different for someone else. For some, pursuing every possible test feels empowering. For others, it feels exhausting. There is no one right answer, only the answer that's right for you. So where does real prevention begin? It begins with the basics. Staying physically active, even light movement each day. Eating nourishing foods that support your bones, brain, and heart. Prioritizing sleep, hydration, and connection with others. These are the things that not only extend life, but also improve the quality of each day. And yes, it also includes continuing to see your primary care doctor regularly, building a relationship based on trust, and working together to make thoughtful choices, not fearful ones. If you or someone you love has ever gone through a test or procedure that later felt unnecessary, we'd love to hear your story in the comments below. Your experience might help someone else feel more informed, less alone, and more in control of their own journey. And if this video helped you think differently about aging and health, consider liking and subscribing for more thoughtful conversations like this one. Thank you for spending this time with us. Remember, your health is not just about test results. It's about how you live, how you feel, and how much joy you can carry into the years ahead.